Okay, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, good afternoon, salam Malaysia Madani everyone. Thank you very much and welcome to today's webinar on Chatgpt and assistant to medical education. So my name is Akmal. I'll be your host and moderator for this session. We have an exciting topic to discuss today. We would like to explore, share with you on a journey to explore the role of artificial intelligence in enhancing medical education. Specifically, we'll be diving into how to use Chatgpt. It's an advanced language model to assist you and us, all of us, as a medical educators in our teaching learning journey. So thank you to the audience for spending your valuable time with us. Before we begin, I would like to outline our program for today. So let me share my screen. Okay. Our outline for today's program is actually, I'll tell you about the brief overview of Chatgpt and its capabilities. And then I will pass the session to Dr. Arif for medical education to tell us about the benefits of using Chatgpt in medical education. And then we will dive into the example of or application of Chatgpt in medical education. We have our e-learning team here, Dr. Luqman from Biochemistry Department, that will share with us with his session on the preclinical teaching and learning. And then we have Professor Madya, Dr. Farah, Dayana from ENT Department. And then we have Dr. Mohammad Nizam Mokhtar from Anesthesiology Department. And then we have Professor Madya, Dr. Tuti, Iryani from Psychiatry Department. So we have, they actually, some of them are a novice user, that some of them are advanced user of the Chatgpt. So before we can proceed to our program, I would like to share with you what is the interface of ChatGPT. Perhaps from the audience, you do not have time or opportunity to go into the ChatGPT. This is a very simple interface of ChatGPT. It's very clean, very wide. All that you have to do is to send a message to the ChatGPT to generate the response. But in this particular webinar, we would like to show to you on what kind of text or prompt that you can type in order to get the responses that you want. So the role of ChatGPT in medical education is basically to enhance knowledge acquisition, to facilitate interactive learning experiences. For instance, that if you want to, conduct an active learning session with the students, you can still use ChatGPT as one of the modalities to facilitate you, not only to generate the lesson plan or to generate a structure of your teaching method, or perhaps to generate questions. And there are a lot of questions from preclinical or clinical. I'm sure ChatGPT also is learning the prompt from us in order to enhance their responses. And also ChatGPT supports self-paced learning among students. So students also can use ChatGPT if we as a lecturer allow the use of ChatGPT in our teaching learning method. Quite recently, actually, we have our Ministry of Higher Education Malaysia, Yang Berhormat Datuk Seri Khalid Nordin, have given a green light to all the universities, whether the lecturers and the students, to use ChatGPT as a part from our teaching learning method. But we as a lecturer, we have to be, in the know. We have to familiarize ourselves with ChatGPT before we can allow to use it in our classroom. So this is the tips on how to use ChatGPT. First thing first, you as a user have to be very clear and very specific. You need to clearly communicate the information and the response that you're seeking from the ChatGPT. use very precise and straightforward language. So very, very like, very simple language. So to avoid any ambiguity, because like I said, ChatGPT also learning from us. So whatever that we put in the prompt, they are trying to improve their responses. So always be clear and very specific. And then you provide context, set the context for the prompts to ensure that ChatGPT understand the specific medical education scenario or topic you are addressing. So I say if you want to put like a topic asthma, so you try to be very context of asthma to what year? Year 4, year 5, medical student or nursing student or emergency medicine student. So you have to provide a whole context to ChatGPT. So this helps to the model to generate a relevant and targeted response. And next, you use the structured question. So instead of you put the open-ended prompts, structure your question in a way that elicits the desired response. For example, what are the steps to do this and this? What are the key considerations when we have this scenario? So it will help to guide ChatGPT response toward the providing actionable information. And then you have to specify the format of structure. If you want it to be step by step, if you want to be a bullet point, or do you want a concise summary, summarize this essay. So you can do that. And then make it specific on the format or structure that you want. And then incorporate keywords. You have to include relevant keywords related to the topic or concept that you want to focus on. So these help ChatGPT's attention and encourage the model to generate a response that really aligns to that particular keywords. And then provide example of scenarios. If the responses from the ChatGPT is not, not really that what you want, you can, provide another prompt that provides specific example or scenarios to make the prompt more concrete and contextually relevant. So it will help the model to generate more detailed responses and practical insight. And then lastly, you have to iterate and refine. So if you do not have the response, the correct response from the ChatGPT, that you try to rephrasing, paraphrasing the prompt and provide any additional clarification to guide the model towards the desired response. So from this, you can provide a detailed instruction, a detailed hints, and specify the desired level of the detail in the response. But no worries, I know this is a very very wordy, but we can look at it when we look at the example given by our e-learning teams. Okay, so I will put it in a very proper, very nice infographic, and I will share with all the lecturers after webinar session. Okay, from this, okay, I would like to invite Dr. Arif to further explain to us on the benefit of ChatGPT towards the medical education. So the floor is yours, Dr. Arif.
Thank you, Dr. Akmal. Can I share the screen?
Yes.
All right. Okay, can you see my screen now?
Yes.
All right. All right. Okay. First and foremost, thank you, Dr. Akmal, for inviting me to join in this so-called webinar on benefits of using ChatGPT in medical education. So if you Google or you read journals or articles on the benefits of ChatGPT in medical education, there are numerous, a lot of benefits using ChatGPT, not only for students, but as medical educators. So I try to focus my presentation on the benefit as a medical lecturer in UKM. So how can we use ChatGPT in our daily tasks as a medical lecturer in UKM? So I've tried ChatGPT for 1 month, okay, after being given this task by Dr. Akmal. So I find that ChatGPT is helpful, but there there are some limitations that we have to be aware of, especially in terms of validity and reliability when it comes to question making and also marking of students' paper. Okay, first is the automated scoring. I just found out that actually ChatGPT can help you to score students' assignment or papers. Okay, the one that I tried was on reflective writing. So I asked the ChatGPT chatbot to mark reflective writing by one of our students. Okay, so I copy paste the writing. I put it in the ChatGPT chatbot and ask the ChatGPT to mark the student reflective writing. Okay, this is what I got. Okay, the scoring, the rubric that we use is called Gibbs reflective writing. Okay, the ChatGPT using an AI, they can evaluate the reflective writing. So the one that we use is Gibbs reflective writing. So the rubric is the same as the one that we use in our faculty. So they can identify the themes that the student wrote. Okay, description, feelings, evaluation, analysis, and conclusion. So the ChatGPT took about less than 2 minutes to read through the writing of the student and also to evaluate their reflective writing. So like what I've shared here, it's very unique and very fast. Okay. They also provide conclusion on the student's writing. Okay. So in this case, the ChatGPT considered the reflective writing by that student as a good level of self-reflection and addresses all the key components of the Gibbs reflective writing. Okay, and then I went a step further, asking the ChatGPT to provide feedback to the writer. And again, ChatGPT doesn't disappoint. So they give feedback based on the structure, the elaboration, the critical analysis. And I went further, asking the ChatGPT to give marks. Okay, this is where we have to be a bit cautious. I sent 2 papers to ChatGPT asking ChatGPT to mark, but they to me they got it wrong. Okay, I scored the first student 8 and the second student 6, but ChatGPT scored them wrongly according to me, according to my experience. So we have to be a bit careful with ChatGPT when it comes to asking them to score the marks of our students' assignment. Though they can give their input on the content of the writing and also give feedback, which I'm happy with. But when it comes to marking, perhaps they don't have the proper rubric that we have. So it's Gibbs, there are many modified Gibbs reflective cycle. So the marking is a bit different than what I marked. So as a lecturer, when we want the ChatGPT to mark our students' marking, I think they are not there yet. Okay. It can also benefit us in the sense that ChatGPT can help us to generate questions. Okay, single best answer question. So you can use this perhaps not in the final exam, but if you happen to have a pop quiz or if you conduct your team-based learning session, TBN session, these are the questions that you can ask the ChatGPT to generate. So you can use these questions not in high-stake exam, but more in a formative assessment. So you don't have to crack your head to generate question. Actually, ChatGPT can do it for you. And the plus point is they can also provide you with the explanation to the answer, to the correct answer. Okay. Okay, you can ask them to provide you with single best answer, not only on a preclinical topic, but also on clinical topics. Okay, here I have the example of 2 single best question for emergency medicine. But again, you as the content expert, you have to validate the STEM, the scenario, and also the options, and not forgetting the correct answer. Just make sure that everything is correct, okay, because you are the content expert. But again, if you were to use it in high-stake exams and say, for example, end of semester or end of module exam, you have to be extra careful using this, okay? Yep. Other than providing the question, they can also provide you with the explanation why the correct answer is, in this case, is B. Okay. They can also use it. You can also use Chatgpt to answer questions. Not only, perhaps this is more of a student's point of view. This is the actual one best answer questions that I got from a PITS final year exam, final professional exam. So I copy paste the question, put it in Chatgpt, and ask the Chatgpt to provide me with the correct answer. Okay, so Chatgpt does not only benefit the medical educators, it also benefit the medical students because they can interact with Chatgpt to provide them with the answer. But like I said, you have to be a bit cautious on the answer, because in this question, Chatgpt answered the correct answer as C, Hinoscholin purpura with nephritis, whereas the correct answer would be D, minimal change glomerulonephritis, and not C. Okay, and then I continue chatting with Chatgpt, saying that the correct answer would be D and not C because the patient has no rashes. Okay, and then Chatgpt replied, yes, you are correct. I apologize for the oversight. So again, I must remind you that you have to use, you can use Chatgpt, but you have to use your own consideration. You have to be careful with the answer provided by Chatgpt. In the area of problem-based learning, okay, this is the actual trigger from a PBL package that we have. So I use the same trigger, put it in Chatgpt, and ask Chatgpt to generate hypothesis. So Chatgpt was able to come up with a good hypothesis. Okay, maybe perhaps a bit too generic. Okay. And then I have to type in further what could be the diagnosis, and then Chatgpt were able to provide me with the list of hypotheses on basically on the possible diagnosis of the case. So it benefits students in terms of personalized learning. Okay, they assist them on their learning. They can learn on their own free time. Okay. Again, another trigger from a PBL. This time on a different case. I cut and paste the trigger, put it inside Chatgpt, and Chatgpt was able to come up with the hypothesis. And also were able to explain on the hypothesis that they have generated. Okay, now on again, still in PBL. So now on patient information sheet 2. Okay, so those who take PBL knows that this is basically where they do physical examination. So I put everything regarding physical examination into Chatgpt and ask Chatgpt to conclude on what's happening. Okay, so they come up with a hypothesis that this patient could be Turner syndrome because of the features. Okay, and you have all the features here. And then I asked Chatgpt to explain the answer. And again, Chatgpt was able to pick up from the PIS what are the signs that says that this patient actually has Turner syndrome. And ChatGPT was also able to interpret lab result. This is on PIS 3. I copy and paste the lab finding, put it into ChatGPT, and ChatGPT was able to interpret the blood result in details. Yeah? The hemoglobin level, the MCV, the MCH, serum iron level, TIBC, and came up with the conclusion that this patient in that case actually has microcytic anemia with low hemoglobin level, low red cell count, and low serum iron, consistent with iron deficiency anemia. So beautiful ChatGPT. It also can help you in terms of research, though it may not be as comprehensive as what we usually do. So you can type in, can you write a research proposal on stress level among UK medical students? And ChatGPT can more or less help you to have a general idea of what your research is going to be about, up to the level of methods, what sample size, how many sample size that you need, what are the methods, the instrument that you may need. Scenario development, if you're in clinical, you can use ChatGPT to develop scenario for you to discuss with your students. And also now is the interview session. I just tried whether ChatGPT can create a scenario for me, okay, to test students on their resilience skill. And happily, ChatGPT came out with the scenario. So you don't have to crack your head thinking of the scenario for interview next year. And also able to come up with lists of prompting questions for interview. So I think that will be all. So in short, ChatGPT offers a lot of benefits, not only to medical students, but also to lecturers, medical lecturers. It's just that you have to be cautious, especially when you consider to use the content provided by ChatGPT or in high-stake examination. Otherwise, ChatGPT is wonderful to help students in their learning, and also to help lecturers in developing scenario and questions, but perhaps not yet into marking of student papers. We are not there yet. I'm thinking of making a research comparing the marks by lecturers and also by ChatGPT. So if it's proven that ChatGPT is reliable and in marking reflective writing, then perhaps after this, we don't need lecturers to mark reflective writing anymore. Okay, that will be all from me. Thank you.
Thank you, Dr. Arif. I think that will be like, a very good example on how to use ChatGPT in the medical education. I'm quite surprised that the ChatGPT can mark the reflective writing.
Yeah.
But please bear in mind to all the audience, this is just a tool to help us in order to, in the teaching learning method or in the assessment, in making questions. But we do need your input as subject matter expert. To have a look again whether the responses given by ChatGPT is correct. That's one. Is precise according to what that tailored to our objective of your program, of your module. I learned a lot. I mean, from Dr. Arif's session. Thank you very much. I just wonder that when student using the prompt from the problem-based learning, so to generate hypothesis, to generate the diagnosis, the management, how can that improve or change our landscape of problem-based learning in terms of it is already active learning, but how can we change or modify PBL further? Do you have any idea on that?
In Western countries, they are moving towards some Western countries that have already had this so-called facilitatorless PBL. So they don't need a facilitator anymore in their PBL. So one, perhaps we can move towards that. Okay, this has been said like 10 years. But furthermore, I think it helps students in their own learning, meaning that they don't have to sit together well, depend on what the LO of that PBL. Usually PBL is not just you gaining knowledge, it's about teamwork and whatnot. So if you're looking solely on knowledge gaining, sorry, so perhaps you can learn on your own, meaning that you can learn using PBL, but you can interact just with your computer, with ChatGPT, no longer with your friend. But that would defeat the purpose of having PBL, in the sense that you want them to learn to work in a team. Okay, so we have to be careful in if you want to implement ChatGPT PBL, I would say, because there are a lot more things that the student can learn through PBL other than just gaining knowledge or creating new knowledge.
Yes. This is a question from Dr. Nasri. Looks like that we can create a QB platform. Then let students design and store their own question. I think I agree with you, but we still need the validation from the lecturer. We do not totally, wipe out the role of lecturers in the teaching learning setting, but we want that to strengthen the role of lecturers, the student, and ChatGPT as a tool. But it helped a lot from the perspective from the student and the lecturers. I remember when I always deliver my lecture, they always ask for the doctor, do you have a past year question? Do you have any sample question? So I was always say that you can straight away go to ChatGPT and then see what is the response from the ChatGPT and scrutinize the responses, and then you can come back to me if you have any question. So I think it will help both lecturers and students as well. So we have question from Dr. Aisha. Salam and good afternoon to all panel. Would the input we enter in the ChatGPT will be stored somewhere and influence the algorithm of the ChatGPT in the future? Do you have any input, Dr. Arif?
Yeah, I believe so, because we learn from ChatGPT, and ChatGPT actually also learn from us. So, like for example, when the marks that I don't agree with, I have a long chat. I don't have it here with ChatGPT. Why I think student A, the score should be higher than student B. So we had a discussion there. So I think that even though student A writing is shorter than student B, but length itself shouldn't be the determining factor on whether student A or student B is better. So I told ChatGPT that okay, usually you should look precisely at the content, on how the feeling of others. You should also consider the feeling of others, not just the feeling of the writers. So I believe ChatGPT also learn from us, not just us learning from ChatGPT. And this will hence change the algorithm of ChatGPT when asked or we're being prompted by the same question again.
Yes. And then the other question, would the input we entered in the ChatGPT will be stored somewhere? Is it for your own references? Yes. They do you have the history or on the left side? You can always revisit the history and all the prompt or the responses. You can always revisit that.
Yeah.
Okay. We have another question from Dr. Surya. Do we need to subscribe to ChatGPT or just download the app? No need. You do not need to download the app. Just straight away go to ChatGPT. You just type ChatGPT and then log in to your email, or preferably your EDU email. And you do not need to subscribe. You can use it, by login through your email address. That's as simple as that. They want to make ChatGPT is very simple, very user friendly, and everyone can use it. Okay. All right. Okay. Thank you very much, Dr. Arif, for your sharing. Next, we will play a video from Professor Madya, Dr. Farah Dayana. Unfortunately, she is not with us today because she is currently in Thailand for her training. So perhaps that we can share that her lecture or her sharing on ChatGPT. Okay, Zaki.
Assalamualaikum and salam sejahtera to all. Welcome to the webinar on ChatGPT, how we're going to use ChatGPT in teaching and learning. And today my task is on about application of ChatGPT in medical education. So I'm Farah Dayana from Department of Otorhinolaryngology. Will share how I use ChatGPT in teaching assistant for effective teaching, especially in ENT for in teaching and learning. So I start. Okay, ChatGPT is a new apps. I mean that is AI that you can use rather than you refuse and also you deny the ChatGPT. We have to embrace the ChatGPT and also use it to help us in medical in teaching and learning in education in medical education. So I think it's very useful. I've done it before and have tried, but you have to think on how to do it, right? So the first one is let's say you choose a topic. Okay, let's say myself, I would choose a topic on the epistaxis, right? So I would like the students to give me the causes of epistaxis, all right? So the information from the, you can always choose a different topic, a broader topic, but I choose this topic because I would like to show how to use it, because this is a very simple topic. Usually I give a broader topic for the students, but I choose one small topic just to show how I'm going to implement the ChatGPT on your education. So I choose the causes of epistaxis as a, so the student can get it information from the book. So this is the information from the book. Okay, so you use a textbook. I choose one textbook, like or student can use other textbook. This is from Dingra. So the student will extract the information from this textbook. Okay, so from this textbook you can see they use a local causes of epistaxis. You can see trauma, infection, foreign body, neoplasm, atmospheric changes, and deviated nasal septum, and also the general causes such as cardiovascular system, disorder of blood and blood vessels, liver disease, kidney disease, drug, medicinal compression, acute general infection, and also risk menstruation. So epistaxis is at time of menstruation. So you can use this two information for the text from the textbook. You can ask the student to extract the information from the textbook. And after that, you ask the students to get information from ChatGPT. So you ask the students to open the apps of ChatGPT. This is my account. Usually you have to open an account for ChatGPT. So you just put a prompt questions there, state and explain the causes of epistaxis. So you can see what ChatGPT generate for you. So, oh, all right, this time ChatGPT generate, they give anterior bleed and also posterior bleed. It's not according to local and also systemic causes. This is not wrong. Okay, this is not wrong because in my lecture, I always divide the causes of epistaxis into anterior epistaxis and posterior epistaxis, and or you can divide into local and also systemic causes. But since in the textbook stated it's local and also systemic causes, so you want the ChatGPT to give you the same or the similar answer according to the anterior and also local and also systemic causes. So you change the prompt wording or the prompt questions you want to ChatGPT to generate for you. So I change state and explain the causes of epistaxis according to the local and systemic causes. So have to be specified. Okay, this is specific. So this ChatGPT, sometimes you can always change your questions, it will generate differently. So I like to ChatGPT to state and explain according to local and systemic causes of epistaxis. So this is what the ChatGPT generate brilliantly, right? So they give local causes and also systemic causes. But you can see from this, some of the information is not in the textbook. and some of the textbook information is not in the Chatgpt. So you have to think, just now in textbook you see there is a renal disease, and there are other dry air, everything, right? So you have to in the textbook don't have any dry air, so you can see there is a different answers. I mean that there is some answers different from Chatgpt and textbook. So you have to discuss with your students, right? So after that, you ask the students to put in the table. So usually I ask the students to type in these tables, or you can handwrite in the table what it is in the textbook and what it is the information from Chatgpt. All right. And after that, they have to rewrite in the textbook and Chatgpt. So what is the similarities in the textbook and Chatgpt in the local causes of epistaxis? This is for local causes, right? And what is in textbook but not in Chatgpt? And what is in Chatgpt and not in textbook? So after that, you ask the students to bring this answer to you and discuss. We always can discuss why in textbook don't have this. Is it correct or not in Chatgpt? Right, in the textbook, but this one there's no in the text, not in the textbook, but in Chatgpt. Is it correct or not the answer? So you can always discuss with students whether it is correct information or not a correct information, and you have to you can also discuss and ask the students to explain, right? So similar like systemic causes of epistaxis, you can always ask the students to put in this kind of table. All right, so this is how we do it. I do it, and I hope it is beneficial. You can always this is just this session is just to see what Chatgpt can assist you in your education. So there's another apps. Okay, this is a very, I think it's not that mature. This app is not that mature like Chatgpt, right? This app is a Gamma app. Is used to basically just to show it is used to create a PowerPoint or presentation for you. So this is a Gamma app, but I think this is not mature because the answer is very superficial, very limited. So you can see, you can choose a presentation, document, or web page. Usually I use presentation or documents. So I put the same questions, local causes and systemic causes, same question that I put in Chatgpt. So they will give you a nice presentation, just like a PowerPoint presentation, nice PowerPoint presentation they will put for you, but you can see that they put just only local cause irritation from trauma and also inflammation and infection. So I think this information from this apps is not as mature as Chatgpt yet, but I will follow up because of this is very nice presentation. They put already, if I say you want them to put in the graph also they can. So that's why this is very, I will follow up these apps whether in future they are mature or not to give us information. So I think that's all from me. All right, thank you.
All right, thank you very much, Prof. Farah. I think from Prof. Farah's point of view, she's trying to incorporate Chatgpt as a part of the active learning with her student. So we have no reservation of using Chatgpt, especially in terms of getting the information from the Chatgpt. But what Prof. Farah did was she turn it into flipped classroom. So she allows the question to be typed into the Chatgpt, and then student will get the responses, and then they will try to compare or scrutinize the information, not all the content expert, but they try to, as a student, scrutinize the information given by the Chatgpt, and then try to compare with the textbooks. And then from there, they will say, oh, this responses lack of something, while the textbooks has a lot of more information, or vice versa. So I think that is one of the application how we can incorporate Chatgpt as one of the education tool. And at the end of the video, Prof. Farah has shared there's another platform, AI platform, totally independent from Chatgpt. By using the same prompt, she can generate a slide I think there's 4, 5, 6 slides that can save lecturers time, because I know that the medical lecturers are so busy. So I hope that by using the Gamma website, you can still use the same prompt and then generate your own slide. Okay, so before we can, please keep the question coming, because I know that most of you are novice user. Sometimes you do not know, where to click, what ChatGPT can generate. So I think we can go to another video, and then perhaps that we can answer question. Okay, can you please invite Dr. Luqman from Biochemistry Department to share on his current practice on using ChatGPT in the teaching learning method.
Very much for your time. I hope my presentation today would be beneficial to you in terms of how I'm sharing as much as I can, how I have been using in ChatGPT in my daily life, as well as my teaching and learning. First and foremost, I would like to apologize. I won't be able to attend this session. As such, I'm drawing, I've made a video instead for you guys to look into, but I will be joining you during the Q&A session. So any questions that you have during my short video presentation, I'm more than happy to answer them. Okay, so I've been using ChatGPT for quite some time now. Ever since it blew up, so I've been applying ChatGPT to pretty much anything that I could think of, be it in teaching and learning, or just general questions, or general ideas to write a script, or general ideas to, I think it is a good assistant in that sense, and it should be treated as such. It's not a carbon copy of you, and you can't expect it to be of the same level as you. So you need to train it for it to churn out ideas that you intended it to do. Yeah. So first thing first, though, in preclinical setting, especially for first year and second year students, you would have to every now and then you would have to shuffle your lecture materials, or at least, you would have to take in lectures that you have no clue on how to start. You may be able, bolehlah kita belajar, kan, kita boleh belajar. So one day maybe dalam rotation, dalam jabatan tu, suddenly you were tasked to do one lecture on metabolism, and it's not your strong suit, or at least it's something that you can learn, but you don't know how to go about with it. So what I did usually is to start with a lesson plan. I know this is macam for all of us, it's something that macam kita boleh pakai, kita dah prepare dah pun, kan? Tapi for new lecturers, it can be a bit daunting, especially wanting to plan something yang kita tak pernah belajar, kan, and how to make that interesting. So what I did here is I wrote a prompt where at the start of the session is that I asked ChatGPT to prepare a lesson plan that incorporates active learning for a period of 2 hours, and I set out exactly the target of this lecture, and I put here the objectives, and usually we can get the objectives from the study guide, okay? So that's a given, so no problem. So we'll churn out immediately a lesson plan that we can follow, okay? So the objectives, the materials, the introductions, okay, and the concept of the presentation. So it gives you a point-by-point idea on how to go about it. And in some sense, because I've wrote here active learning, so it rules out a section where you have a group activity incorporated in your lecture. So something that you can do and prepare. And following that group activity, you have your class discussion and reflection, conclusion, and wrap up. So it's not so much that you have to follow this, but it gives you a general idea on where to start. So you can always, every now and then, if you feel like macam, no, I don't like the class discussion part, maybe we can replace that with something else. And you can just simply write down a prompt, and dia akan ubahkan that section into another section of your interest. But in general sense, for you to start off something that you tak pernah mengajar, and content-wise kita boleh belajar. I mean, we can learn that in our own time, but actually presenting it to a first-year student, so it has to be, engaging. So what ChatGPT does is it provided you with an instruction that you can simply follow. Anytime that you tak suka, you can always change. All right, so you're done with the lesson plan. Okay, maybe now I think I would like to draw up some presentation slides. Okay, but I don't know the flow. What flow would be suitable in this sense? So to put simply for a novice, I mean, you can just you can write this prompt here, the one I've presented to you, and please write the presentation slides for a mini lecture, concept clarification section for 40 minutes for the first year clinical students, and you're still using the same objectives. So it draws up for you a number of different slides, its title, okay, and things that you can actually add on to your lecture slide. Okay, it's not comprehensive, and sometimes it could be wrong. Kan, the information tu macam salah. So this is where we come in as an expert lah in the field ataupun expert in the knowledge to actually critique. Kita tengok macam suitable ke slide dia ataupun macam info dia betul ke tak. So kita tengok, we see. But at the very least, what ChatGPT has done is that it provided you with a flow of where you can start, apa you nak kena tambah kat sini, apa you nak kena bincangkan dekat situ lah. Kan? So up here dia bagi you sampai 14 slides, key takeaway, Q&A. So overall is what? 16 slides altogether. Recap the main points. It's not comprehensive, but you can fill in the gaps, and you can fill in your own, and you can even ask ChatGPT, say, for slide 9, I think it's too short. Can you suggest what sort of figures that I can input, that can be added into this particular punya section? Okay. So it will churn out ideas for you. So you can play around with it. Yeah. And then, okay, so you've done that. Maybe you want to incorporate a number of quiz questions into it. Okay. So you ask ChatGPT by tasking it to prepare a set of quiz questions, maybe 3, again, to complement your mini lecture. And again, to your target audience and what the objectives are. Dia akan quickly keluarkan 3 soalan ni, promptly, kan? So, lipolysis, glycolysis, and so on and so forth. It's simple quiz questions that you can copy and masukkan dalam quizzes, kan? And it gives you the answer lah. But sometimes kita rasa macam soalannya macam I think it's a bit too specific, and you think macam, oh, I think I want to make some of these questions dalam exams. Contoh. I'm not saying that you can actually, tak ada masalah pun, kan? But again, you want to make it more specific, kan? So you tukar sikit dia punya soalan tu menjadi apa? It has to be thought provoking. It's difficult to guess, kan? It's best for each question with a relevant clinical scenario. Answer items must be limited to 4, set in a manner that one answers. So dalam this section here, I actually tell ChatGPT what one best answer is rather than one correct answer. Yeah? So soalan dia lagi spesifik. The answer items tu lagi spesifik dan lebih berkaitan. Yeah? So a patient with uncontrolled diabetes mellitus is admitted to hospital. The primary goal of treatment is to reduce elevated blood glucose levels. Which biochemical process in the liver would be best beneficial in achieving this goal? So lipolysis, and then sebab kita minta kat last tu kan, justify the answer chosen, dia justifikan for us. Whether it's correct, factually correct or not, itu tanggungjawab kita. Kan? Kalau kita rasa macam, soalan best lah soalan ni, aku nak masukkan dalam exam, pergi vet. Kan? And see what's what. Kan? So that's that. Kan? So soalan, so dekat sini I minta 3 je lah. Kan? So these questions aim to test students' ability to apply their knowledge of metabolic processes in different clinical scenarios. Selected answers emphasize the most appropriate and contextually relevant solutions in each situation. Okay, kita dah settle dengan benda tu, dan right now kita rasa macam maybe kita perlukan satu essay. Kan? Again, it's the same thing. I added the objectives. Kan? Kita minta dia to generate 10 mark multiple essay questions. Okay? For the target audience kita adalah your first year preclinical students lah, on the subject of metabolism. So the questions must be based on single preclinical scenario. So kita minta satu je scenario, if possible, kan? And provide answers, potential answers with breakdown or marking points. So membantu kita untuk kita set up the rubric lah, kan? So dalam case ni dia bagi how many questions here? ada several questions, 3 soalan actually. So kita boleh pilih lah mana kita rasa sesuai kan. Just maybe kita tak nak bagi during the exams, tapi kita nak students to sendiri tulis kan, for an SLP ke apa ke kan. So clinical scenario, Sarah, first year preclinical student has been practicing intermittent fasting as part of lifestyle. She wants to understand the metabolic changes that occur during different fasting states. Explain the biochemical processes that take place in the adipose tissue, liver, brain and muscle during feeding, fasting and starvation states. So ni adalah contoh jawapan dan macam mana kita nak mark kan. 3, 2, macam itulah kan. Kalau kita rasa soalan pertama tak okey, soalan 2, soalan 3. So soalan 3 ni dia tergantung kan. Yes, kenapa tergantung, kenapa tak complete? Because it's free version, so there's only a limited number of I think characters lah that it can churn out. So usually I just tulis complete lah, dia akan complete kan, marking breakdown so on and so forth lah, and dia bagi note kat situ. So after running all the activities and based on the lesson plan, ya, the active learning, kita dah sediakan lecture slides, kita dah sediakan we have asked Chatgpt to help us to churn out quiz questions, and maybe for SLP kita sediakan satu essay lah kan yang students boleh buat, and so kita boleh mark later or even for an MES session kan. So right now kita kata okay, I just want to listen to the feedback lah based on this module ke ataupun this particular subsection within a module tu, kita nak tengok bagus tak benda ni kan. So help create a feedback form for the students to assess the activity learning, the active learning activity that they had undergone and how it has improved their retention of knowledge. So boom, dia akan terus bagi soalan-soalan yang kita boleh pakai terus, and benda ni kita boleh terus copy paste dalam apa, I'm not say copy paste directly, but with minor adjustment can be used dalam Google Form kan. Rate of effectiveness, specific aspects of the learning study yang kita rasa yang student suka kan, active learning compared to traditional lectures kan. So something that macam benda simple yang kita boleh buat terus kan, tak perlu kita nak letihnya nak kena fikir macam mana soalan yang sesuai apa semua tu kan. So something that you can do immediately kan. Okay, so if say kalau kita rasa macam okay, not bad lah for a first lecture, the feedback was good, everything was organized, so on and so forth, and kita rasa macam I would like to make this session ataupun the content of this session, I want to make it I want to spread it out to the public kan. So the easiest way to do it is by having a podcast, ataupun you ada short courses program yang you rasa macam alamak macam sesuai, tak adalah alamak macam best je kan kalau kita masukkan this particular lecture into a short course kan. So the easiest way to do it is setting up a podcast, and Chatgpt can help you with that by actually generating a script. So dalam case ni, I minta dia to generate a 10-minute script for a podcast. This is my target audience, yeah, and this is the expected content. So basically the same one that we've been teaching the students lah, kan? We asked Chatgpt to write it in a tone where it is fun and engaging, kan? And caveat lah kita letakkan a restriction lah that this session mesti not too academically inclined, so anyone yang dapat dengar tu macam boleh absorb the knowledge kan. So provide relevant example scenarios can relate to when explaining the information. So instantaneously dia akan keluarkan as such lah. So you have your podcast, intro music, host, metabolize your life. So grab a smoothie, lace up your sneakers, and let's get ready to energize our knowledge. Okay, boom. Okay, and kalau kita rasa macam okay, I have a Twitter thread now, so I rasa macam tak semua orang nak dengar Twitter. I don't think not everyone likes to listen to a podcast, so maybe a Twitter thread is much quicker. So I cook up this prompt, a simple one, can change it into a Twitter thread, and boom, so 1/8, so everything with all the emojis and whatnot. And you can copy paste this and the hashtags, so on and so forth kan. So that's that lah. So that's pretty much my presentation. So my take from this is that it is an assistant. It helps you in the long run. It helps you to market yourself. It helps you in teaching and learning, and is always back and forth with it, so you can actually learn. I mean, the challenge is to write proper prompts to get what you intended. Yeah. So it's not something to be afraid of. It's not something to be, it's not daunting. A simple prompt, just one simple line of prompt can help you in the long run. So that's that. So I shall see you guys. Thank you so much. I'll see you guys again during Q&A session.
All right, thank you very much, Dr. Luqman. Actually, Dr. Luqman is with us. He got finished his class at 2 o'clock just now. I just wonder, because I think that there are lots of from our audience here, not really, not really, they sometimes they do not have like new slide. Sometimes they are given lah, okay, Akmal, now you ambil slide ni, topic ni, this semester you are going to teach that. So I think from the perspective of the Dr. Luqman's presentation, you can use that topic to generate your lesson plan, to go for even script some more. So let's say I heard like from FITM they want to do the open distance learning, and then they need to have like they have to record their slide from 10 minutes slide. So you can ask ChatGPT to generate the script as well as you can give them the lecture objective, and then try to prompt ChatGPT to generate a 10 minutes script, and then slide, even the slide for like, let's say 10 minutes, one slide equivalent to 1 minute. So you can always give the prompt to the ChatGPT so they can generate it all, I mean, like in minutes, right, Dr. Luqman?
Yeah, it's seconds actually. So depending on how it depends on you write the prompt. So the longer you write the prompt, the more things that it can churn out. So you have to remember that if the caveat of using ChatGPT is how well you write the prompt. So yeah, but it's actually quite instantaneous. So the link that the prompt that that I showed to you in my video just now, the lecture the script was actually less than 1 minute. So straight away a 10-minute script, and you can always, if you're into that, like if you're into the open distance learning kind of thing, you have the content, you just don't have the idea. So some people even copy the script, post it to another different AI that can speak for you. So you can choose the voice of Morgan Freeman to narrate that script and post it on a video. So if you want to make money, that's how people are doing it. So we are in the business of sharing ideas, sharing knowledge. It's best us doing that. You get what I mean?
Yes.
So because we have the knowledge and we know the limits of knowledge as well. Yeah. So the script is instantaneous. Yes.
Okay, so actually we have 3 questions actually been answered by Dr. Arif. So for first question, we have Dr. Anissa. At the right lower part of the ChatGPT website, there is a link saying upgrade to plus. Do we know that we need to pay for this? As for now, ChatGPT, the one that we have showed you is the free version. But do we need to pay for the upgrade? Do you have any?
The upgrade, they use ChatGPT 4. The one that we are having now for free is ChatGPT 3.5.
Yes.
So if you interact a lot with ChatGPT, you want faster response, so then perhaps you may need, or you may want to subscribe lah. Otherwise, I think the free version is sufficient for me.
Dr. Luqman?
Because now there's a lot of plugins with a lot of different websites, web pages. You can, if you're using the paid version, then it probably help you with research, and you can actually upload a PDF of a paper, and you can ask ChatGPT to tell you certain questions about the paper, about the results, or even to the point where if you have a table in the PDF is a table, you can ask ChatGPT to explain the table. So it will reshuffle back the table to a manner where it helps you digest the information easily. So that's how good it is now, but you have to pay, of course. But for the sake of you just wanting ideas, something that you can do straight away, this is where it comes for me. Like, that's how I do it now. So I haven't paid, I haven't subscribed to any payment methods. Not yet.
But I think for the beginner user, I think you do not have to use, to upgrade the plus. It's sufficient to just use the free version. is good enough actually to create the prompt, the responses according to our prompt. The next question, does ChatGPT search cover English resources only or multiple languages? Dr. Arif said, you tried it but in bahasa Melayu and it works. So it sounded like bahasa Indonesia. Yes, correct. Sebenarnya dia banyak more to bahasa Indonesia lah. I tried juga untuk buat sakarangan dalam bahasa Melayu. I tried even Google Translate. I put it, I type it in English and then I tried, I asked the ChatGPT to translate it for me. It sounds like weird sikit lah, macam bahasa Indonesia sikit. So we have to, kena tengok balik ayat dia. Tu tak boleh nak copy paste sangat lah, kan? But I haven't tried the other languages.
Yeah, it's a nice exercise for you to try. Yeah. The best, if we can show a live demonstration, will be beneficial. But again, the caveat of using a free version is that you have to share the server. So sometimes you can't even get into ChatGPT, the free version, because the line is so full. So you need to find a time, maybe after subuh or just late midnight, to play around with it. But most of the time it's open. But if you're using the paid version, you can access ChatGPT anytime, anywhere, no problem. And it's even on your phone. Actually, you can. There's an app for it. So rather than going to the website, sign in and everything, just sign in on an app. So yeah, live is that easy, to be honest.
Okay, that's good. Okay, can we proceed to the next speaker, our panelist, Dr. Nizam that will perhaps share some of his input on using ChatGPT. The floor is yours, Dr. Nizam.
Thank you, Dr. Akmal. I'll just share my screen. Okay, Assalamualaikum and a very good afternoon to all. So, so for ChatGPT, I think most of our panelists has explained quite a bit. Probably a part of it a bit redundant, but I'll try to explain in more detail, or maybe more simplified version from what we have learned. So you can actually start off when you open up the ChatGPT. You can start by a simple short question, saying that, okay, let's practice history taking in a simulated patient. Okay, and then this is what we get. So basically, certainly I can help you practicing history taking in a simulated patient, and then but however they ask you to provide some information based on the scenario. So I wrote there, you are a 23-year-old patient who had a low back pain. So then they come up with a very good script or dialogue between patient and also a doctor or healthcare professional. So basically you can use this for because some of us who are in the clinical setting needs to teach in the CSL sessions for the first year and also second year medical student. So this can actually help you in terms of preparing like a script for students who are attending for your clinical skills session. So they give you basically the nature of back pain, and then what questions that you need to ask later on, and then everything that we've learned in medical school. Basically, we just try to enforce that. So scale from 0 to 10, and then rate the pain, and then elevating factor, relieving factor, and things like that. So then from there on, you can actually prompt ChatGPT to give a good clinical case. So basically, from the scenario above, what are the investigations that we can do to help with the diagnosis? So they give you they list down all the possible or necessary investigations, and with that also they also provide you the reasoning behind providing the reason behind ordering that kind of investigations. Like for example, X-ray, you can identify abnormalities, fractures, sign or degenerative changes. For MRI, you can actually identify any herniated disc, spinal stenosis, and soft tissue abnormalities. Blood tests, the ESR, CRP, or any autoimmune tests like rheumatoid arthritis, ankylosing spondylitis. And the reason you want to do urinalysis or EMG or nerve conduction studies, and they give you all these good reasons why you want to order these investigations. So this actually can help you in guiding the students preparing for your clinical skills sessions in terms of history taking. So next, I want to talk about using ChatGPT for diagnostic reasoning. So I asked ChatGPT to create a clinical scenario for teaching medical students for diagnostic reasoning. So basically, they give me this scenario where there's a patient who complains of fatigue, weight loss, intermittent fever over the past few months with night sweats and cough. And then at this point, they also give me, what are the learning objectives for this session. So, we want the students to actually generate a good history and also examination findings, evaluate the differential diagnosis based on the clinical scenarios that was given, interpret the results given, and also the management plan for these patients. And also give you the activities that you can actually arrange or you want to develop with the students. Either it's a group discussions, or it can also give you some individual research. So it can be both between these two groups, whether you can do individual research or group discussions. So it's really good in actually provide with the case scenario. It gives you the diagnostic reasoning on the case itself. So basically, I'll just find out what is actually the differential diagnosis for the case that was given. So they, list down the possible differential diagnosis, and they also give you the explanation, why they think the differential diagnosis is. So, like tuberculosis because of given a persistent cough, night sweats. So, and also lymphoma because of the fatigue, weight loss, and night sweats as well. So all this actually it's like a preparation for you, before you, give a scenario to the students, or preparing for, small group discussion or problem-based learning after award rounds and things like that. So then you can actually ask the ChatGPT what are the possible, appropriate investigations that can be generated from the diagnosis that's given above. So again, you can actually ask this within one short, long questions on ChatGPT, but I like to make it more simple. So I like to do one by one. So actually, I like to ask one question at a time and then prompt ChatGPT from there. So they actually come up with all these differential diagnoses and what are the investigations that are necessary, to evaluate or to actually exclude all these possible differential diagnoses, which is quite good. So I also use ChatGPT in assist in creating a new PBL pack or a case-based discussion. So I asked ChatGPT, I asked ChatGPT, please create a problem-based learning pack for medical student for a man with a chest pain. So basically, they will come up with this case scenario, and then they also give you the learning objective. What are the expected outcomes from the problem-based learning? And then they also give you the introduction and all the activities that can be done during the PBL session. So basically, it actually really helps you in terms of preparing yourself, save you a lot of trouble, creating all new stuff every time. So basically, but at the same time, you actually have to double check, whether it is actually relevant to your teaching, or actually the level of the medical student. So you can actually from there also, you can put there, problem-based learning pack for medical students in year 4 or year 3 or final year medical student. So they will tally the questions based on their level of competency or level of medical school. And again, they will give you all these activities that they can run together. Either it's individual individual research or small group discussions. So from there, you can actually, create all this necessary discussion between the students. So from there, we know that, from all the panels that already talked to you, we know that, the questions that can we use ChatGPT to create exam questions? But actually, I think the right question is, should we use ChatGPT to create exam questions? And then I think from there on, I think Dr. Arif and also Dr. Luqman has told you, you can actually use ChatGPT to create exam questions, probably quizzes. If you want to do for a professional, for end of semester exams, you can use it, but you use it as a guide, and then you actually have to vet the questions as well, whether it's actually relevant or not. So basically, I would say that if you want to use ChatGPT to create exam questions, you cannot entirely use it, but you can actually use it as a guide, as a starting point, and you take it from there. Okay, that's all. Thank you for listening.
Thank you, Dr. Nizam. I think it's a good example for the young clinical lecturers on how to use ChatGPT to develop their own teaching learning package. And then especially for the, for those who do not have any educational background, they don't know where to start. So I think with the right prompt, and the right tool, I think you can generate that as easy, as what Dr. Nizam has shared with us. Do you have, like, for your first experience, for the initial experience of venturing the function of ChatGPT, do you have any problem, let's say, like the ChatGPT generated wrong responses, or maybe the responses is not really up to what you want? Do you have any some sort of experience?
Yeah, I think initially when I started, asking questions in ChatGPT, the answers that they're given is not really relevant. But when you start prompting, and then probably after a few times, and then they start to learn from you, like what Dr. Arif was telling us about. So the answers become more better and better every time. So let's say you ask the question today, and then you ask the same questions 2 days later, the answers can be different actually. It will be better most of the time.
That's good. That's good. That's good to know. Thank you very much, Dr. Nizam. So I think we have the last panelist of the day. Professor Madya, Dr. Tuti, Iryani from Secretary Department, that focuses on, but because we are already covered on the undergraduate study, we want to go for the role of ChatGPT as a tool for the postgraduate study. So I would like to invite Prof. Tuti. Prof. Tuti, you are muted. Prof. Iryani, you are muted.
Unmute. Okay. Assalamualaikum and good afternoon. So I'm moving on into a bit of postgraduate, and I guess being academicians, we you can see my desktop, the site. Okay. So being academicians, we can't run away from wanting references. Okay. So what I found here is CITE, SCITE. Okay. So my prompt here is write an essay on cognitive behavioral therapy in psychosis for postgraduate psychiatry. So this is the prompt, but you can, okay, always you not reference, you not reference, you not how long, short, medium, or long, which year to which year, and bidang apa, kata kita medicine, and publication type. So you want RCT sahaja pun boleh, okay, and what type of citation style, and then you type apply. So this is my prompt, and this is what I got, okay, and I guess you can use this in many ways. One is, of course, your academic research, but you can use this for your creating postgraduate questions. You might want, because you might want to be able to justify your answers. So having references would be good. So so this is the app that we can use. Is Scite, SCITE. It is paid version. When you want to sign up, you have to put in the your bank card details. However, it is 22 ringgit a month atau 180 ringgit a year, which I think for 22 ringgit, I think you just go out makan McDonald, makan tengah hari pun dah berapa 20 lebih dah kan. So I do think at this moment that's the price lah. So I think it's to me, I personally think it's worth it. Okay, I want to show you dekat belah kanan. They call this smart reference. Nampak ya? What is smart reference? So contohnya this article, reference to this, do people with intellectual disabilities semua ni. This is number, so dia pergi straight kepada reference, tapi dia nak cakap berapa reference yang support this citation. Okay, this one is how many mentioning this reference, but how many contrast the citation. So it's very smart. So nama dia, that's why it's called smart reference. So that's I find that's really good because we want to look at both references that support and contrast in terms of our reference. So just want to show maybe a prompt. Okay, this is a prompt. Write an essay on de-escalation techniques, focusing on practical aspects. Include verbatim examples that you can say to a patient who is agitated. The presentation is targeted to nurses. So even though this is not postgraduate, but I think I like the, when I present something, I like to have references. So that's why I prefer to be more careful. So in this essay, they included this verbatim examples and what you can say to the patients, which I really like because they are the practical implication as well. So it wasn't as good as turn the above essay in the to 15 slide presentation. Maybe I need further prompting for this one. Okay. So I just wanted to show you when you want to use AI, but with references. So this is the AI. Okay. So another one is SciSpace. SciSpace is free. Okay. So what you can do is you can upload your PDF. Okay. And what you can do is you can say, okay, this is the PDF. Can you explain the abstract? Okay, so that's dia dah ada prompt siap-siap kat sini. Explain the practical implications of this paper. Okay, so sorry, so tak boleh, tak apa. Mungkin dia dah ni. Okay, so you can do that. What's the method used in this paper? I'm not sure why it's not. Is it because it's free? But you can. This is a one that you can ask the co-pilot to summarize your whatever you want to read. Can you summarize the introduction? Can you summarize the conclusion? If there's a graph or there's a table, can you explain the table? And they can do it for you. So you just need to highlight je lah, highlight kat mana, and then dia boleh explainkan. So this is I'm not sure why it's not working at this moment, but this is another one, size-based. So these are the things that you can do for critical appraisal. You can, you have a critical appraisal session, or you have a journal club. You can prepare your journal club by using size-based. Yeah, so I think that's all from me. Thank you.
Thank you, Prof. Tuti. I think the reason Prof. Tuti is explaining about the site and the size space because of the limitation of ChatGPT, right? Because at least for the free version, the ChatGPT, when we talk about research on how to summarize the research data and whatnot, they are not really up to par yet. They are not really, mature yet. So that is why Prof. Tuti is suggesting these two website on site and size space to help us, especially in the journal club or journal critics with your postgraduate students. So do you have like any other application that we can use ChatGPT for the postgrad? Perhaps Prof. Tuti, you have some sort of experience on using ChatGPT?
For others, for postgrad, at this moment, I think this is the two of my favorites. Because I don't use ChatGPT because of the restriction. I use Bard, B-A-R-D.
Or B-A-R-D. So there's another AI tool. It's a Google Bard. It's from Google, right? From Bard.
Yes.
But I think the limitation for Bard that you cannot log in using your edu mail. You have to log in through the gmail.com. So you can also Google, venture the Google Bard. Is that another AI tool that's I think keep booming on the TikTok, Twitter, because like the ability to summarize the whole paper, and then it helps you a lot in terms of creating proposal and whatnot. So I think it is worth noting that we have actually a lot of AI application apart from ChatGPT to help us as a medical lecturers. Okay, so do we have any questions from the audience? Okay, so perhaps that we can share, I would like to invite Dr. Luqman to share with us, because among us, Dr. Luqman is an avid user of, hardcore user of ChatGPT. So perhaps that the limitation of ChatGPT and what to look out for when using ChatGPT. Do you have any thing that you want to share with us?
I don't know where to start, to be honest. I mean, I kind of like follow the trend. So it was booming one day that everyone been using it. So there's even a number. I'm not sure whether it's factually correct. I mean, it takes years for you to get a certain number of users for Facebook to get the age. But with ChatGPT was like instantaneous within a month to get that number of users. But if you're using the free version, the limitation would be that the knowledge or what you get now as an intuitive, intelligent assistant is based on the thousands of people that has been prompting it since the day it was released. Yeah. So the knowledge it has on its own is, I think it's from 2021. So ever since then, we've been feeding it information into the system. So it learns from there. So kalau orang, if other people is coming in and ask this kind of like the same question and they critique about the response and whatnot. So you would have, so it grows. The more people using it, the more reply that you can churn out. So is it safe? Yes, it's safe. It's not safe, but it's okay, because the fact of the matter is you have to see it again as an assistant. So it's not something that you take as gospel truth. Okay, I want to write a paper, boom, boom, boom. It churns out one nice essay, you submit it. Number one, it gets flagged, turn it in now. Can flag ChatGPT when you're responsive.
Yes.
And then the one other limitation, again, is the references. The bad thing about ChatGPT is that they make up it make up its own references. So although you see the DOI number, the title, it's fake, to be honest. So definitely, if you Google search again the same article number, about the title and whatnot, you're not going to get it. So ChatGPT is like that. And the fear of relying too much on ChatGPT is that if someone, okay, you know one thing that is factually correct, you feed it in, and then you have 10 people saying, no, that is wrong. So there's a with the system. So it may churn out different responses. So that's why, like Dr. Nizam mentioned, what you write today is different. But usually it's always going to be improved version if you use the same prompt again the next time, next week, so on and so forth. But it may not be the case. So this is where we come in as an expert. We check whatever that is producing, whether it's factually correct or not. So I've been using it just for the sake of, like asking general questions about something. I wanted to learn about algorithms, so random forest. Okay, so AI generated model. So I asked it to explain to me as if I'm 5 years old. So it does. And I learned from it. It took me ages getting textbooks here and there, just trying to understand what is random forest. Okay, the algorithms and whatnot. So I asked it, okay, can you explain this to me as if I'm 5-year-old? Okay, I'm a novice. Explain this. The same explanation with a bit of context for me at my level. And it helps. And I said, okay, can you help me produce data from it? So it turns out a fake data that I can plug in straight away into into whatever software, if you use Python or whatnot. So it generates the prompts, the code and everything. So you learning. I mean, obviously you need a guide to tell you what is correct, what's not. It's our job the lecturer's job again. So, but for a guy who knows nothing, that's the simplest source you can get. So you can have the option again, like Google Bard. Again. So if you want the same kind of response, you can use Bing. Bing is ChatGPT powered. So that's how I've been using
Good. But I think ChatGPT had the potential to significantly enhance medical education.
Yeah.
So, but we have to know its limitation.
Yeah.
We have to know. You do have to consider some ethical consideration and the importance and human expertise. We still need human to validate the information, the responses given by ChatGPT. Okay, so we are approaching 4 o'clock. Thank you very much to all the panelists, to all the audience who stayed until the end. Thank you very much. And then I hope that this webinar on ChatGPT assistant to the medical education has helped you a lot. Perhaps that it will trigger you to start and open up the ChatGPT and start using it. So we hope that you gain valuable insight into the role of AI in medical education. It's not only ChatGPT, we have a lot of any AI tools, and we hope that ChatGPT can contribute to enhance our learning experience for future healthcare professionals. Please, I think the Cik Taki will show us the QR code for the feedback form, and once you fill in the feedback form, you will get the e-certificate directly to your email. So thank you very much again. Have a good day.
Thank you, everyone.
Have a good one. Have a good one.
Assalamualaikum.